the size of Israel. It's a very small country. There are 30 million people in Nepal. There are only 10 million people in Israel. But Israel have proved some changes. It's a young country, almost 75 years Israel now. But during the 75 years, at the beginning, there were terrible shortages and lack of development. Things have changed. And now Israel is at the forefront of development, of high-tech, and of changes, whether it is agriculture, whether it is education, and whether it is health. Now, I came here today, and I'm very much impressed to see the changes here and what you are doing, the team here. And you know, a hospital is like a body. You can't live without the ears, you can't live without the legs, you can't live without the heart, and you can't live without the kidneys. Everything is important, and I think this is the combination of what is happening here. I'm very much impressed to see the staff, to see the infrastructure, to see the equipment, and the most important thing, to look at your eyes and to understand the good intentions of people. I hope we are all healthy, but you know, this is the human nature. Sometimes we are not healthy. It can happen. And I think that your part, what you are doing to the community, to people here in Kathmandu, is essential, is important. You can't have a modern country, a modern society, without modern medical treatment. This is it, Kegane. It must be included in the lifestyle of the city. So I know this is only a soft opening.
Absolutely.
But it will take another week or 10 days or 12, never mind. It will be definitely during the next month. So I wish you all the best. Keep your good work, keep your devotion, and continue to help your community. When you talk about modern countries, you have some kind of arrangements, some things that must be included. When you look about traditional society, people lived in the villages. Maybe once a year they go to the main city. But life expectancy was low. And this is the traditional situation. Now countries are changing. Israel was established in 1948. This is 74 and a half, 75 years ago. And the situation was very, very basic. Before that, we were colonized, and this is the year that we got our independence. And there was a challenge of the leaders. What do you want to see in the future? How do you envisage the changes in the society? So there were many, many investments that the Prime Minister decided to have. And it is the same Prime Minister that later made the contacts with Bibi Koirala. The first Prime Minister of Israel, David Ben-Gurion, with Bibi Koirala, had very close relations, and later they established the relations in 1960. The first item of investment was, of course, in education. If you don't invest in education, you cannot move forward. But you know, what you are doing here is life-saving. So actually, in Israel, the investments in health sector are very part of the GDP. If you don't invest, you don't get a result. You can't give the services. I am very impressed to see today, again, the team, the staff, the people that are working here. I'm impressed to see the infrastructure. I am impressed to see the equipment. And these are the things that you also have in Israel. So today what this project is doing, it is bringing Nepal into international standards. And this is, you can't live, you can't have a modern country, modern society, modern healthcare without having international standards. And as I said, I wish everybody good health. It can happen. It can happen And I don't wish that something will happen, but it can happen, and we have to be prepared. And this is like your insurance program, that if God forbid something happen, the relations, many Nepalis go to Israel on different programs. The programs on agriculture are very, very famous, and it's an important sector. But I want also to mention other sectors of cooperation. We have cooperation on education, we have cooperation on media, we have cooperation on NGOs, but we have a very important cooperation on the health sector. And the health sector in Israel, as was mentioned earlier, is advanced. People are going with our scholarships. They go for Israel for a month, for 2 months, for 3 months, and they come back. And they come back. And if I will have to say it 5 times, I will even say it. Because the program that we are doing is not an assistance to an individual. It's the assistance is government to government, country to country. How should I say? Brain drain is not an assistance to the country. So you are welcome if you have your staff, if there will be an interest to train in Israel, people are most welcome, whether it is on the level of the medical, the doctors or the nurses or the team, the administration team. As I said, it's a body. There is no difference. Everybody is doing all these things. Only recently I'm saying last week, and also on next Monday, we are taking people for the caregiver sector. And again, they are not going to settle in Israel. They are going for a period. There is a contract, and they are coming back. And I'm sure that people are going to be trained. It's an on-the-job training, and it's work. So I really hope to see the continuation of the changes here. Yes, please.
How do you observe Nepal system, not from the eyes of ambassador, but from the eyes of Dilwale?
How Nepal is doing on health, on education, on what? I mean, you have...
You mentioned that your Nepali name is Dilwale. So I got that it's your second time in Nepal.
Yes, yes.
So how you observe in eyes of Dilwale, not the ambassador?
I will tell you, and this is a very complicated issue. I was here 10 years ago, and to come here 10 years later to see the changes. Nepal is going through a dramatic change, and the dramatic change is on so many aspects. You know what, since we are talking about health, I'll give a small example about life expectancy. When I was here last time, it was 67. What is the number now? 72. And actually, we, the men, live lower than the women. They have to suffer from us 70 years, so at least they get extra 2 years than the men. But this is the nature in Nepal, in Israel, in all countries. You think that this is a minor change? It is not. Addition of 4 years to life expectancy in a decade is a revolution, and this revolution has not stopped yet. I will tell you, we will sit here in 5 years, the 72 will be 74. It's not jumping, in a day. It's a process, and I think that what we see here is part of this revolution. So the things are changing all over the country. Literacy. People are educated. When I was here, there were 10 colleges in the city. I think there are 100. So you see the young generation in years ago, 20 years ago, to have somebody to complete the +2. The SLC, the SEE was the Iron Gate. People ended at the Iron Gate. So again, we can sit and I can give you a list of 20 dramatic changes, and I wish Nepal to continue the progress. It is good. Progress is good. To respond, it took us 36 hours to bring 300 doctors and medical team. We have established the field hospital in Chauni. that was doing a lot of health activities there under the army. So in terms of problems, of difficulties, or like the earthquake, Israel can make the response in hours. And again, this is a symbol of the good relations that we have between.
Technology, we can't expect a modern country or modern city. So we need to include the modern health system. And I think recently COVID had taught a lot of the thing to us. So I think Frontline is coming up as a very modern hospital with a very well equipped, with a very trained staffs, and with a very innovative idea of Dr. Chakraj Pandey. On his leadership, I believe this hospital is going to cater a lot of health, services to the Nepalese, not only in Kathmandu but outside the Kathmandu, and especially in trauma, as we are conceptualizing a lot of things in context of trauma and in medical education. So without taking much time,
20 years in education sector, like a nursing, public health, pharmacy, in education institution, lots of lab technician programs we have already run. But new this venture is changed the name of Noble Hospital. It's converted to the Frontline Hospital. So I would like to inform you all these hospital facilities as a modern in the context of Nepal. We are going to give a good healthcare service in Nepal, and media and friends. High Excellency is the second time of ambassador in Nepal, so he knows all about our society and changed the healthcare system in Nepal. He had lots of experience, and I would like to thanks again to visit as a chief guest of today's program, and then all the participants of healthcare professionals.
Education, like a pediatric symposium, congress, all those things contribution have been made by Israeli healthcare professionals. Other thing is a trauma care. Israel has one of the biggest trauma facility in the world. In Tel Aviv University, they have the, like there's a terrorist attack and a lot of things are happening. They are so quick to respond and so quick to save people's lives. So those experiences have been shared with us, our doctors, and thank you for that. Your country has really contributed in positive direction to Nepal. So I think we let's try to be a little modest. What Excellency has been telling good about Nepal, but we must understand we are not in that level. That is his good gesture towards us, but we need to work very hard. But the possibilities are there in Nepal, and that depends on all of your hard work, honesty, diligence, and we have the work value is 3 Ds, which is diligence, determination, and dharma. So this is the concept of this institution. We want to look beyond, and today we are very small, little, but in due course of time, by the friends like Excellency, their support, your support, and all of our leaders' support, doctors' support, I think we can hit one of the biggest goals to provide the best health care for our country, not only for our country, for our visitors, our tourists, our expats, our ambassadors who are residing in Nepal. It is important for us to be the best. We have no other choices.